This segment is sponsored by Advanced Pain Care.
Orthopedic conditions can affect lots. It's the muscles, nerves, joints, bones, tendons, ligaments, and any other tissues that act as connectors. It can be short term pains, such as sprains or fractures, or lifelong issues like arthritis. So, dealing with them deserves expert care. And here to tell us more about how he does just that is Dr. Brett Robin with Advanced Pain Care. Dr. Robin, good morning.
Good morning. Thanks for having me.
Thanks so much for taking time out of your busy schedule. Let's talk about how you guys work at Advanced Pain Care because you can do surgery as an outpatient procedure. I'd love to hear the benefits of that as compared to a traditional hospital setting.
Yeah, so there's a lot of benefits from doing surgery as an outpatient, and this is something that we've really noticed the last, 5 or 10 years of how much better patients can do at home. The biggest benefit that I see from patient standpoint is just the amount of comfortableness that they have at home. Once in a hospital setting, there's a lot of alarms going off. There's nurses coming in and out of your room at odd times. Your sleep's interrupted. The trauma of the surgery is enough. And so maximizing your rehab and getting home to your own bed where you have control over your pain pills are there by the bedside. You can take them when you need them. You have ice packs that you can get when you need. And as long as you have the proper support, which is something that we ensure before we let you go home, I really think that patients do better both mentally and physically when they're able to go home.
Oh, that's wonderful to hear. And obviously, a quicker recovery is what we're looking for. I have a feeling you're able to relate to your patients and what they're going through with their injuries on a personal level.
Definitely. I got into orthopedics through sports, which is how a lot of us orthopedists get to this route. But early on, I tore my MCL in my knee in the state championship game in 1996 when I was a sophomore in high school. And I think that was my first of many visits to my orthopedist. I was really amazed at what he was able to do and how he worked with me and how the process of being at the very bottom and being low and thinking you're never going to get a chance to play the sport you love again, and then rehabbing and or having surgery to get back to doing what you love. And so that was my initial interest, and then I just followed that throughout college. Again, had a lot of injuries playing football in college, so it's something near and dear to me. And I really feel like when somebody comes to me, I can see the worry of, am I going to get to do what I love doing, whether it's CrossFit or mountain biking or simply just walking up and down the street every day, just to get out and get some exercise, and being able to say, look, we have options. We're in this together. We'll figure out and we'll do whatever it takes to get you back to doing what you love doing.
We've heard a lot about how you chose, kind of this path as a doctor, but can I hear just a little bit more about why you specifically chose orthopedic surgery as a specialty?
Orthopedics is really unique in medicine because you have a chance to make an immediate difference. And so we treat a lot of different conditions, basically anything from shoulder to foot, including spine. I don't do spine myself, but these musculoskeletal conditions can be an acute injury, they can be chronic, such as arthritis. And so every person's condition is different. And I don't feel like anything is repetitive. I have a new challenge with every patient I see because no injury is the exact same. And even though someone may tear their ACL and that's a common injury, the next person may have an ACL and a meniscus tear or an ACL and a PCL. And so these injuries are each unique to each person and their goals. And so I just find it fascinating to learn more about what the person's goals are, what they do in life, and then finding a fix to get them back to doing what they want.
Oh, yeah, no, that's nice to hear. And I know that you guys put every single patient at the very center of what you do. And since you do so much, research into each new thing that comes up, I'd like to hear from you. What sort of advancements in the field of orthopedics do you see coming up in the next few years or in the future?
Yeah, that's a great question. Orthopedics is changing very rapidly. I did a fellowship 7 years ago, and I almost don't do anything the same way that I learned in fellowship. And that all has to do with technology, both in the operating room with robotics, with navigation, computers, but also with implants. And so in orthopedics, we use a lot of different implants. And there's been a huge advancement of what we call biologics, which is helping the body heal with adjuncts such as PRP, platelet-rich plasma, bone marrow, and just ways to encourage healing that we can get people back to doing what they want to do sooner. But I think the biggest advancement that's coming in the field of orthopedics is definitely the addition of computer algorithms, but not just the computer algorithms, but also the actual robotics and making certain cuts and knowing what we're doing well ahead of going into the surgery using CT scans, MRIs plugged into the computer, but also real time during the surgery, having that guidance to make sure everything's done with perfect precision.
Oh, so fascinating. Yeah. We appreciate, of course, that you guys are continuing education for yourselves, continuing to train on all these brand new things, because it means that
Right.
we get the benefit of cutting edge technology from advanced pain care right here in Central Texas. Dr. Robin, I know you've got a full schedule this morning, so I won't keep you any longer, but we really appreciate your expertise. Thank you so much.
Of course, thanks for having me.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today. This segment is sponsored by Advanced Pain Care.